The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Welcome to Meet the Doctor. My guest today is Christine Hamori. Tell us about yourself, Dr. Hamori. Where do you live and where do you work?
I live and work in the same town in Duxbury, Massachusetts, which is a seaside community about halfway between Boston and Cape Cod, and I've been there for about 25 years.
Is it considered Boston or is it
It's considered
not
a
really?
suburb of Boston.
Yeah.
Yeah.
What is the town like? Is it kind of beachy? Do people go there on vacation or?
It used to be more of a summer destination, kind of like Nantucket or Cape Cod. So yes, it's on the ocean or the Duxbury Bay. It's a big boating community. There's a lot of rowing. My sons are rowers that they did in high school. And it is very beachy. And now more people realize it's a pretty easy commute to Boston.
Oh, no.
So it's maybe like a 30-minute commute. So now everyone's moving there and tearing down nice little beach homes, making big McMansions. But it's still a lovely community with a really good high school, and it's fun.
Did you grow up in Boston too?
Nope, I grew up in New Orleans in Louisiana.
Okay, those two towns could not be more different.
Very different, very different.
Give us maybe the short version of going from New Orleans to Boston, and I'm sure your training and your education was in there somewhere.
Yeah, so my parents moved to New Orleans probably when I was like 7 years old from the Philadelphia area, and I ended up going to high school there, and my dad's a very good fencer, was an Olympic fencer, and I too fenced in college and went to Cornell for undergrad. Kind of got away from Louisiana, and I kind of liked the weather, the seasons, even though it was a bit cold in Ithaca. So then I went back to medical school at Tulane for 4 years, and I still enjoy Mardi Gras and Jazz Fest and everything, the food and the crawfish, everything about New Orleans. And then I ended up doing general surgery in Boston at BU, and I really fell in love with the city and proximity of the city to the ocean and the Cape, and you could go skiing, and I just never left really after I went there for general surgery. I went to 2 years to Philadelphia to go to Penn for my plastic surgery fellowship, but I like the Northeast now.
And then how did you fit having kids into this whole situation?
Good question. It was complicated. I'm one of the ones that had them after the training. So I had my children relatively old at 39 and 41, two sons. But I had them just when I started building out my office in Duxbury, my first office there with an operating room, and went into solo practice after being in academics for about 5 years at BU in Boston.
Did you have a particular academic focus while you were there at BU?
I did a lot of breast reconstruction and a lot of breast reductions. There are a lot of women with extremely large breasts. It's in a poor community, Boston City Hospital, and we just did a lot of those breast reductions and also breast cancer reconstruction.
And is that still part of your practice today?
Nope. I stopped taking insurance probably about 22 years ago. I'm focused purely on aesthetics now. I have a med spa. I'm doing a lot of, I still do breast reductions, which I love those surgeries, but now insurance isn't covering a lot of breast reductions for people, so I'm able to do those people very easily.
How did that early experience with both poor patients, but also, the technical experience of doing reconstruction and reduction, how did that kind of inform your aesthetic approach?
We're still worried. I think as a plastic surgeon, we're always focused on the aesthetic, and it's more challenging actually with a recon patient or even a very large breast reduction to get that to look really good. And I think that I kind of broke my teeth doing that, and to get those people to look really great. Now when I have an easier, less tonic, less large breast reduction to make it look beautiful, I feel that I can do it. It's a little easier because I really learned the hard way. So it did help. It definitely shaped my aesthetic, and I still feel like I'm really helping people be happier about how they feel about themselves and be more athletic and happier with their shape.
So 22 years ago, you went into aesthetic practice by yourself. And this was during the time that breast implants were off the market, wasn't it?
Correct. Yes, it was just in the moratorium, was just about to be lifted. Yes, when they had for 10 years, we couldn't use gel implants. And I was only used to doing saline implants. And even in residency, we were mostly doing saline implants. So that was a little bit of a shift, some positive, because now those gel implants are more pliable, they're more natural looking, they don't ripple as much. So that were the positives. The negatives is having to educate patients on how they're not as easy to manage on the long term as a saline implant, because you need to have studies, ultrasound or MRI to figure out if they're intact and monitor the implants. So it took some time. And when I started switching over to gel, it was strange for me because I was so used to just doing one type of implant, saline. And I always tell my patients that might be interested in saline now that I did a lot of saline breast augmentations and very few came back to switch to gel. So they were happy with what they had. So I especially my younger patients, I still encourage to do saline if they're in their early 20s, because who wants to be tethered getting MRI or ultrasounds in these young years? Let them have saline for a couple of years, and if it's really important later on in life when they switch at 15 years, they can go to a gel.
So that shift from the early silicone to saline and then back to silicone, I think was really challenging for consumers, but also challenging for solo practices. And then it was kind of quiet for a while, but now there's another shift happening.
Right, with this breast implant illness and what we know about ALCL. So yes, we're feeling like we have to go back and prove to our patients again that these are safe devices. And I really do think that the data, at least in breast implant illness, is pointing in the correct direction, that there's no physical ailment they're causing. But we are finding that people that want their implants removed feel better after they're removed. So there is, whether it's a psychological component or if they have very particular biology that we don't even know how things are affecting their body, those particular implants, and they're getting better, I'm all for removing them. And as I age, my practice ages with me, and a lot of women in their 50s and 60s want the implants out anyway. They're done with them. They've gained a little weight, they have menopausal fat on their tummies, and they feel like they don't need to have the big implants anymore. So you remove them, you do a little breast lift, and they're perfectly happy.
Is there a style that you see a lot in the Northeast?
Smaller breast implants, for sure. Maybe 200, 250, sometimes maybe a 275, 300, but definitely not what you hear about in like Texas and LA or 450. I mean, very rarely do we put in something that's
walk outside and look on the street.
Here it's a different story. Here it's crazy.
Yeah, I've seen some interesting things. It's hard not to look.
Right. I mean, they're not wearing anything really to cover them.
No, they're not. And if you're reacting, then I don't feel so bad.
No, I do too. They have like some sheer like fishnet on. I'm like, is there a top under there? Like, you just like, okay. I'm here with my 17-year-old son. I'm like, don't stare.
Yeah, a friend of mine went to Macy's yesterday for a bra.
Yeah.
And she said, they had tons of bras. And I said, well, yeah, no one's buying them out here. They're not wearing them.
There's a lot in there. I love it. I love it.
They're just trying to move them. So, yeah, those trends are really interesting. And are there other trends that you're seeing, especially since your patients are probably people who've come back again now, 10 or 15 or 20 years later after they saw you the first?
More now they're transitioning to different body parts, definitely more facial things, more people interested in facelifts, and I've always seen my mentors, older plastic surgeons above me, kind of going toward more above the shoulder type procedures. And that's happening to me now. I'm like surprised to see patients in their 60s and 70s and 50s even coming in asking for their eyes done or their facelift. And it's lovely that they're coming back and I get to follow up on my other results that I haven't seen in 20 years. And then a lot of tummy tuck still. I think women in their 50s and 60s are interested in looking really toned and fit now like they did when they were 40. They're not going to tolerate a muffin top. They're not going to tolerate, not feeling their best in their body. So I still see a steady stream of patients, even though we're all getting older.
And do you have a team around you that's doing other things like non-surgical?
Yes, I do my own injectables, but I do have a team of aestheticians, and I do have a partner, Dr. DiEdwardo, who also is on Real Self, and she does some other different kinds of surgery in my practice. But yes, it's a big team. We have probably 12 people in the office, including our OR staff. But we blend well together with the med spa. We do a lot of facial rejuvenation there, body tightening. I have a whole women's center, so we do a lot of vaginal procedures for women in menopause, for people that have stress incontinence with leaking urine, things like that.
Those are some of the most gratifying and life-changing things that we can do. And can you tell us more about that?
Yes, it's very many women come in general complaining that they have issues with their, at the gym, or they're coming maybe for a tummy tuck, and we have like questionnaires to kind of screen other kind of symptoms. And it turns out, yes, I have to wear a pad every day when I go to the gym because when I, jump or get on the trampoline with my kids, I leak. And these are things that now we have some very good non-invasive options to help. Things just like Emcella, which is the electromagnetic pulse therapy that does 20,000 kegels in 30 minutes. Or we also have some wands that do microneedling, Morpheus 8V inside the vagina that helps improve collagen and blood flow and helps a lot of women with vaginal dryness, which is really crippling for your perimenopausal patients. They really suffer and feel like they have to use lubricant and maybe go on estrogen intravaginally for these issues that are happening. And now we have some new devices that are really helping.
Are you doing anything like hormone replacement with these patients too?
I don't do hormone replacement. I have a person that I refer to. I thought about doing. I'm a very big proponent of hormone replacement, but right now I don't offer it at my office. I send to a wellness clinic.
It sounds like it's a bit of a small town too. So
right, exactly.
Yeah, you have other people who you refer to in the neighborhood.
Yes, definitely, that helps.
How many plastic surgeons are there in Seaside?
In my town, there are 3, but only 2 of us have an office in the town. The other 2 are male, and they have their offices in the hospitals.
So you're the only non-hospital one.
That's right.
Female plastic surgeons have some significant advantages that I think women respond to really well. And I wonder if you have seen that over the course of your career at all.
Definitely. I mean, there's like a sisterhood, I think, a little bit amongst the plastic surgeons ourselves, but also in relationship with the patients, because especially when it comes to the vaginal below belt stuff, for sure, they don't feel like they can confide as well in men. But I think just the aesthetic, a lot of people I came to a woman because you understand breasts better, or you understand aesthetic of the abdomen better, and recovery in kids, we just kind of get it a little bit better. I'm not saying there aren't wonderful male plastic surgeons, but a lot of women now just feel more comfortable coming to a woman. Same thing in gynecology. I mean, I don't know, a lot of people don't go to male gynecologists anymore.
No. I don't even know if they...
They exist, but yeah.
Do they?
Well, just like urologists, a lot of urologists that see male or men. It's just, they're not uncomfortable.
Yeah, well, it makes sense. So... You mentioned at the beginning that you have 2 sons and that they were rowers.
Mm-hmm. One is a freshman at Trinity College in Hartford, Jackson. He's on the varsity rowing team. He's very excited there. And it's good. It's about 2 hours from our house, so he can come home sometimes. Yes, so that works out very well with him. And I have another son, Spencer, who's a junior in high school, and he's my football player, loves football and working out and lifting and cooking. So it's nice to have still a son at home, which is great.
Did they ever want you to talk about work? Were they interested in what you did at all?
They are. Yeah, they definitely, my older son is more interested, I think, in what kind of happens at work and procedures that I do. And the younger one's a little more skittish of blood, and it just doesn't have quite as much interest in it, even though they both love biology. And now that they're starting to learn more about like biochem and organic chemistry, they're realizing that that's weaved a little bit into medicine. And I think that that's kind of interests them a bit. But we all want our kids to be doctors. Rarely do they become doctors.
When your patients are women and you're a woman,
Mm-hmm.
I expect that the topic of kids comes up a lot every day. So you probably get to talk about them frequently.
Yep. And I learned a lot from my moms about how they're taking care of their teenagers and our frustrations and taking care of our elder parents. So really, when we see patients in the office, it's lovely. It's just, you get to, it's like a lot of friends that keep coming back to see you, and it's just really fun.
If someone's coming to you for the first time and has never been to see you before, what should they expect?
They should expect that I have a very beautiful, welcoming facility with nice staff, chocolates available, and tea. And it's a very cozy environment. And my staff is very polite. And we have my medical assistants will bring patients in, talk to them. I'll come in later. And I love sitting down and talking to people, so I can basically, I feel like I can make people feel pretty comfortable naturally right away and tease out what they're there for, which I think is difficult, sometimes as the doctor-patient relationship to try to figure out exactly what they want and what their expectations are, and then basically teach them. I'm using a lot of prompts in the examination room or consult room just to show them before and after pictures and show them diagrams of how we do things. Because I think now with the patient's ability to go to the internet and look things up, you really have to educate them well on what actually happens and what are safe procedures that we do, and not so much hearsay they're reading on the internet. And I basically am pretty succinct with them. I'll examine them. I'll tell them honestly what I think I can do for them and what I can't do. And I think it's a good experience for patients. It's efficient, and I think people feel well educated, and it works for me.
If someone was to reach out and possibly come see you, where can they find more information about you?
They can find more information on my website, which is christinehamori.com. They can call 781-934-2200. Also on social media at Christine Hamori is another way.
Thank you for sharing so much of yourself. We really appreciate it.
You're welcome.
If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor, or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.